Hi, I'm Dr. Ann Peters, the Director of the Clinical Diabetes Programs at the University of Southern California, and I'm here to tell you about the results from a study looking at the benefits of continuous glucose monitoring. For those of you who do not do continuous glucose monitoring routinely, I'll explain what it is. It's a device that measures blood glucose levels continuously for patients, and it consists of three parts. One is a sensor that the patient inserts into the subcutaneous tissue, and then to that is attached a transmitter. The transmitter sends a signal to a receiver, and the receiver is either an insulin pump or a small pager-like device that gives the patient a continuous sense of what their glucose levels are. It also has alarms and alerts that let patients know if their blood glucose levels are falling too high or too low, so the patient can react to their blood glucose readings. The results of a study on continuous glucose monitoring were presented at the recent European Diabetes meeting. The study is known as the Artificial Pancreas Project and was funded by the JDRF. In this study, they took 322 individuals and randomized them to a control group where they just monitor their blood glucose levels like they always do with finger sticks, or to a continuous glucose monitoring group. These patients ranged in age from kids to adults, and there were basically three groups. One, the pediatric group, included kids from the age of 8 up to age 14, the adolescent group from age 15 to 24, and the adult group were 25 years of age and greater. When the results were analyzed, it turns out that only the adult group saw an improvement in A1C. Now, this was a very significant improvement. Their A1Cs fell 0.5% without an increase in hypoglycemia. There was not an A1C reduction in the adolescent or pediatric groups, but when the data was further analyzed, it revealed that the adult patients wore their sensors much more continuously. The adult patients mostly wore the sensors 6 or more days a week, versus the pediatric and adolescent patients who didn't wear their sensors all the time. So this seemed to be the big difference in terms of outcomes between the two groups. The study was not powered to look at rates of severe hypoglycemia, although rates in both groups were low. So in summary, continuous glucose monitoring has a real potential to help our patients with type 1 diabetes. To me, a 0.5 reduction in hemoglobin A1C without increasing rates of hypoglycemia is very significant, particularly because these patients were pretty well controlled at baseline. But it also shows us that patients need to wear these devices pretty much continuously so they can react to changes in their blood glucose levels, their diet, their exercise, whatever variables occur during the day that make their blood glucose levels go up and down. So thank you. This has been Dr. Ann Peters for Medscape.